Thanks, Tony. And we're joined now by Dr. Tom Inglesby for advice on how voters can stay healthy and safe as they cast their ballots. Dr. Inglesby is the director of the Center for Health Security at the Johns Hopkins Bloomberg School of Public Health. Good morning, doctor. Thanks for being with us. How concerned are you about coronavirus transmission at polling stations? And should people feel safe voting in person?
I think if people follow simple instructions, take normal, kind of sensible actions, that the risk can be as little as going to the pharmacy or going to the grocery store. But they have to think about it ahead of time, plan ahead of time, and then act in ways that public health suggests when they're at the voting place.
What about those polling stations where masks are not required?
Yeah, well, in every place in the country, people should be using masks when they vote. I mean, going backwards to what they should be doing before they even get there, people should think about when they can vote, where the fewest number of people will be there. And in 20 states today, the polls are still open for early voting. So I think I'd recommend going today as opposed to tomorrow. There's less density of the crowds. If you go tomorrow, then try to vote at a time when most people aren't there. We know that people go to the polls before work or during lunch or after work is over. So if you can go mid-morning, mid-afternoon, there are less people there. Yeah. Before you go, you bring your pen, if you need to plan ahead, bring a chair if you need it, bring 60% hand sanitizer or hand sanitizer with more percent alcohol to be safe. And look at the sample ballot before you go. Know who you're going to vote for, know what the ballot questions are, so that when you're inside, where the risks are higher than outside, you can get in and get out quickly. So that's what I do before you go. But when you're at the poll, then follow the things that we're supposed to be following all along. Wear a mask, whether or not your state requires it. It's important for everyone. It protects your neighbor and you. And the second thing you should do is keep your distance. When you're in line, make sure that you stay 6 feet away or more from others. And it doesn't matter if people are wearing masks, you still need to stay away from them by at least 6 feet. Yeah. And then before you go into the polls or out of the polls, make sure you use hand sanitizer.
Yeah, I should say in my polling station, early voting last week, everybody was being extremely careful and everyone was being very respectful of each other. It was very encouraging. So hopefully that's being replicated around the country. As you've heard, Dr. Fauci has said in recent days that he fears we're in for a whole lot of hurt in the coming weeks, and that we could not be positioned more poorly. What do you fear is ahead of us at this point?
Yeah, unfortunately, with the way that the numbers are rising on a daily and a weekly basis, I think we're headed for very high numbers of cases, more hospitalizations, and higher numbers of people dying from this disease. I think it's not a foregone conclusion. I think we do still have our fate in our hands. But governors and other leaders are going to have to change direction in places where cases are surging. And people are going to have to change the way that they're acting and change their decisions in places where the cases are surging.
We're at 100,000. We're at 100,000 cases a day. You think it can go a lot higher than that?
Yeah, there is no set peak for this virus. This virus is looking for people to infect. That's what it does. It hasn't changed since the very beginning. And we know that most of the country still is susceptible to this virus, is still vulnerable to this virus. So the thing that's going to change it isn't the virus, but it's what we decide to do. It's whether we decide to wear masks, whether we decide to distance ourselves, to not gather in large numbers. We have to do those things ourselves to change the course.
Dr. Tom Inglesby, thank you so much for being with us.